Thank you and welcome to the show this morning. The topic for this morning is making changes for life, and we're fortunate to have with us a person from Metro Nashville General Hospital, Ms. Consuela Green. And of course, Ms. Green is the outreach director for the program Making Changes for Life that is located at Metro General Hospital. And of course, Ms. Green, let me welcome you to the show this morning.
Thank you for having me.
And to allow you to give our audience some additional information in reference to these two ideas that we've introduced, and that is Making Changes for Life and the Center for Health Style Management, for health management at Nashville General Hospital. Of course, we'll talk about that. But before we get into that, Ms. Green, let's give you an opportunity to give our audience some information about your background, your education, and some of the things that were important in terms of eventually leading you to the Center for Lifestyle Management, and then we'll get into some of the other topics.
Awesome, awesome. First of all, thank you for inviting me to the show. Again, I am the outreach director for the Nashville General Hospital's new clinic, the Center for Lifestyle and Health Management program. Our program has been in existence now for about 9 months, and we're a baby, but we're just starting. We received a grant through Nashville General Hospital through the Centers for Disease Control. They gave us this grant actually because so many people in this area, as you know, are affected with so many chronic illnesses such as diabetes, heart disease, stroke. And because of that, we were awarded this grant to open up a new clinic. How I landed there actually is just all divine. I've been in this program now for about 1.5 years, but I've really been working in the area of public health for about 8 years in various community settings. I love working with people. I love working with the community at large. I just love working with public health. My background is with Tennessee State University. It's my undergrad, so I'm an alum. My master's in Health Services Administration is with the University of St. Francis in Joliet, Illinois. And I just recently received a Master's of Business Administration as well. So I'm very excited about working with this program and about working to change the lifestyles of Nashvillians.
Now, the program that you're involved with is called Making Changes for Life, and exactly an overview of that. What does that mean?
Well, that's our logo. That's actually our tagline. Our center's name is the Center for Lifestyle and Health Management. And we like to say the two key words there is lifestyle, and then we want to look at that word life, making those changes. The Center for Lifestyle and Health Management program is birthed out of many programs that have been here in Nashville for years. There are so many individual programs that have been here that have assisted individuals with these chronic illnesses, particularly the North Nashville area. And because North Nashville has been the target area for so many diseases, because of our lifestyle, and we'll talk about that a little bit later in the show, because of our sedentary ways, the Centers for Disease Control awarded us with a grant. And this grant was to help those individuals to change behaviors. And so when we look at the lifestyle, we're looking at not a specific time frame, because we often get used to working with individuals and changing their behavior for maybe about 3 months or a month, and then they go back to the old ways. But we want to help them to sustain change over time. And so that's what we're thinking about and when we say making lifestyle changes.
Are you reaching many people? I know you've been involved with this only a very short time, but is that catchment area a large one, or do you have? Actually,
it is. The Center for Lifestyle and Health Management, and we say short lifestyle center because it is so long. We're actually looking at individuals who are in Davidson County. So it goes beyond the North Nashville area, although we have the highest statistics of death rates due to diabetes and cardiovascular diseases in North Nashville. We're looking beyond that into the Davidson County area. The grant is only for that area, but we are looking, because this is a model program, it's a national program that we received in conjunction with Nashville General Hospital and Congressman Cooper. We're looking to extend that, and hopefully because of the number of people that we have coming in, that we'll be able to extend that program beyond Nashville, and it's a model program to the country. So hopefully they'll be able to duplicate our efforts into other countries, into other states.
And so you've already identified and you already believe that what you're doing here in this particular center is something that can be applied all across the nation, not only among African Americans or in situations like African Americans find themselves in, but all over dealing with a large number of other people. Is that what you're saying?
Absolutely, because when you look at the statistics, if you even look at the map, the southern states are the states that have the most problems when it looks at diabetes and heart disease and so forth. And so we're looking to duplicate these efforts in other cities. And we know that the things that we have, the program that we have in place, will be able to not only sustain in this area, but will be a benefit to all communities.
Very good. Let us take this first commercial break, Ms. Greene, and then we'll come back and we'll allow you to continue this discussion. And of course, we'll be back with our audience following this very, very short commercial break. Excuse me, we're talking